This module focuses on the process of values-based decision-making. By the end of this module, the viewer will be able to understand values-based decision-making and its methodology, state the two core values of the profession of pharmacy, describe situations when conscious application of values-based decision-making is useful, identify resources available to support registrants, and apply values-based decision-making to pharmacy practice. During this module, we will look at two case scenarios to illustrate the application of values-based decision-making. We begin this module by answering the question, what is values-based decision-making? Every day, pharmacists, pharmacy technicians, and students in a broad range of professional and personal settings conduct themselves in a manner guided by conscious and unconscious decisions. Values-based decision-making is a process in which decisions, actions, and attitudes are guided by the core values of the organization, in this case, a profession, and specifically the profession of pharmacy. In choosing to become and remain a member, registrants accept the responsibility to adhere to the core values. Given the central role of pharmacy values in determining member conduct, how are these values defined? Pharmacy values are reflected in a code of ethics. Historically, this code has been a set of principles supplemented by a set of rules that registrants had to follow. The current code sets out the core values but does not list rules. In this way, the Code of Ethics serves as a compass, providing direction based on the profession's values rather than giving a list of step-by-step instructions on what to do and what not to do. Values-based decision-making replaces the rules. It provides a process that bridges the gap between the values and the appropriate actions in any given situation. The core values listed in the code are embodied in two questions that registrants must ask themselves. Will what I am about to do result in promoting and protecting the health, well-being, safety, and interest of the public and/or the patient? This question addresses the member's duties to the public. And will what I am about to do hold forth the independence, integrity, and honor of the profession? The question addresses the duties of conduct. The action of most pharmacy professionals largely represent the best interest of the public and uphold the dignity of the profession. There are, however, circumstances that may present a challenge in meeting these values. First, there are times when the pharmacy professional may have to consider a course of action that is supported by one bioethical principle, but goes against another. For example, disclosing the health information of one patient when another patient's safety is at risk. Deciding not to cover a high-cost medication so that resources may be used to serve needs of other patients. Initiating narcotic therapy for pain despite the risk of addiction. Second, history has shown many factors can overtly or subtly influence the profession. Personal, economic, organizational, and societal factors may influence our action in ways that may not be in the best interest of the public. Values-based decision-making will guide our actions in a way that ensures that our duties to the public and duties of conduct take precedence over these other influences. When does values-based decision-making apply? Values-based decision-making applies whenever the Code of Ethics applies. When most people think of ethics, they think of ethical dilemmas, situations that can occur in any setting in which the professional must make decisions in the face of competing values or principles. Ethical dilemmas, however, represent a small portion of the situations where values-based decision-making applies. As described in the introductory module on the Code of Ethics, registrants must recognize the ethical principles at play in all daily activities and conduct themselves accordingly. The Code of Ethics and values-based decision-making is thus more than a document that is occasionally applied to specific situations. It guides our behavior, and as such, is a reflection of who we are as pharmacy professionals. As there is no rule book, how can registrants position themselves to determine the most appropriate courses of action? There are several tools and resources available. First, a strong understanding of the bioethic principles is necessary to determine which actions support the duties to the public and duties of conduct. The principles of beneficence, non-maleficence, respect for persons, and justice provide the foundation of how actions uphold the two core values. Please refer to the Code of Ethics for more details on the bioethical principles. The process for values-based decision-making ensures a comprehensive evaluation of the facts, values, and factors at play that establish the context in which a registrant must make a decision. It also ensures that promoting and protecting the public interest is the priority. There are 4 steps in the process for values-based decision-making. Before starting with the process, pharmacy professionals need to recognize that their actions warrant consideration under the Code of Ethics. Many times, unconscious decisions and behaviors cause professionals to act without considering the values at play. Often problems arise not because registrants made the wrong decision, but because they acted without pausing to identify that there is a choice to be made between various actions. We will consider this further in the examples at the end of this module. The first step in the process is to gather the facts. The facts provide the context under which the decision is being made. They could include patient health information, understanding of disease and the consequences of action or inaction, and the evidence regarding the potential benefits and harms of treatment. Sometimes the issue is a therapeutic problem rather than an ethical one. The therapeutic issue must be addressed first. Only then can we move on to determining whether we are facing an ethical situation. Other facts may include information from other healthcare providers, financial considerations, Canadian law and pharmacy standards, and other facts that impact the values or factors at play. It is important in this phase to gather the information as completely and objectively as possible, and to avoid making judgments. The next step is to make sure that everyone agrees on the facts. A registrant's perspective on the best course of action will be heavily influenced by their understanding of the facts. If their understanding of the facts changes, their perspective on how to respond may change. In many instances, reaching agreement on the facts will clarify the course of action, making it an important early step. This will also be examined later. Next, the values or factors that influence the situation must be considered. These values include the bioethical principles. However, as mentioned in the Code of Ethics introductory module, many other influences may come into play. In the 4th step, the registrant should identify the course of action that prioritizes promoting and protecting the public interest. The rights and privileges restricted to pharmacy, including the right to be a self-regulated profession, are based upon the fact that our actions will support the best interest of the public. Even when recognizing conscientious objection or economic viability, the priority remains to serve the needs of the public. Sometimes there may not be one clear right answer. Acknowledging the values and principles supporting different courses of action can facilitate making the best decision possible. After identifying the option that promotes and protects the public interest, the registrant must make a decision and take action. It is important to ensure that the action is executed appropriately by defining the correct manner to perform the action, the correct people involved, and the correct time to complete the action. After completing the process of values-based decision-making, registrants should document their decision and the supporting facts, values, or influences. This is important if a registrant needs to justify the action at a later date. It's also important to reflect on the decision after it has been made. Did the decision achieve the desired goals, or should the situation be handled differently in the future? Values-based decision-making is a skill. It can be developed and improved over time with practice and the appropriate evaluation. There are resources that support your ethical decisions and actions. The college has a web page dedicated to the Code of Ethics and professional development opportunities pertaining to ethics and professionalism. Registrants within the college can access modules in the series, commentaries, high-quality educational offerings from other organizations, and notices of upcoming live sessions pertaining to ethics and professionalism. Beyond this module and learning resources listed on the college website, engaging individuals who might bring a different perspective to the situation can be helpful for determining course of action. Individuals include your colleagues and managers, ethicists, as well as experts working within pharmacy advocacy and regulatory agencies. Their experience and knowledge may provide insight and options that were not initially considered. While seeking counsel from others can result in better decisions, please consider these cautions. Certain platforms may not be an appropriate place to discuss pharmacy matters. Discussions regarding patients, other healthcare providers, or business challenges in social media, or even in a pharmacy within earshot of the public may violate ethical principles and fail to uphold the dignity of the profession. A registrant may share opinions that may not be a reflection of core values. We often work with others that are not members of the profession. It is important to recognize differences in priorities and values to determine if the advice offered is appropriate. Existing cultural norms may not be congruent with standards of practice or code of ethics. The idea of what would a typical pharmacist or pharmacy technician do may not justify an action. The focus should always be on what should be done, even if the majority might not follow that approach. We will now look at values-based decision-making as it applies to two case examples. After seeing the cases, many professionals will know how they would intuitively respond. The cases will allow us to focus on the process, as it is important to have a system to support decisions and to understand how they were derived. As we will see, the process can also help identify a plan that can prevent problems from happening in the first place. In this scenario, Anita, a pharmacist working at a community pharmacy, faces an ethical dilemma involving Mr. Bush, a regular patient of the pharmacy who has just been discharged from the hospital. It is late Friday night and the pharmacy is busy. Mr. Bush has arrived at the pharmacy directly from the hospital with a discharge prescription. one of his chronic seizure medications is not on the discharge prescription. Mr. Bush has been stable on the medication for years and does not recall the physician at the hospital telling him to discontinue the medication. He explained to the pharmacist that his stay in the hospital was for an unrelated issue and that his family physician is not available until Monday. Let's take a closer look at this scenario.
Mr. Bush, the pharmacist is just on hold with the nurse at the hospital. She's checking to see whether you were given your seizure medication while you were there. Just have a seat. It'll be a few more minutes.
Hi. Thanks for looking into this. So the medication is on the MAR with the same dose and frequency, and there are no notes about discontinuing it in the patient's records? And you can't get a hold of the doctor to see if he intended to discontinue it? Okay. I'll discuss it with the patient. He seems eager to get home. I really don't understand why we would want to discontinue this medication, particularly given the potential risk if not taken.
Now let's take a look at a number of options on handling the scenario.
Thank you for waiting, Mr. Bush. As you know, I don't see your seizure medication on your discharge prescription, but the nurse did confirm that you were taking it in hospital. The hospital doctor may have had a reason for discontinuing it, so I'd feel a lot more comfortable if you would talk to your family doctor on Monday to confirm if she wants you to continue taking it. If she wants you to continue taking it, she can give you a prescription or fax one over to the pharmacy.
It's funny, I've been taking it quite a while and I haven't had any trouble.
I understand, Mr. Bush. And given that your hospital stay was unrelated to your seizures, I don't really know why we would discontinue it. But the hospital doctor might have had a reason, and I can't get a hold of him to clarify. So I really would feel a lot more comfortable if you would go in to see your family doctor on Monday.
Okay, I'll make an appointment on Monday. Thank you.
Thank you for waiting, Mr. Bush. As you know, I don't see your seizure medication on your discharge prescription, but the nurse did confirm that you were taking it in hospital. Since your stay was unrelated to your seizures, I'm not really sure why the doctor would want to discontinue. He may have had a reason, so I'm going to double check with your family doctor on Monday and discuss it with her, and I'll let you know what she says. If she wants you to continue with the medication, I'll get her to send over a new prescription. Thank you for waiting, Mr. Bush. As you know, I don't see your seizure medication on your discharge prescription, but the nurse did confirm that you were taking it in hospital. You've been on this medication for a long time and have been stable, so I think that it was most likely unintentionally left off of the discharge prescription. But it is important that you continue taking it. I don't have a prescription that I can fill for it right now, but you'll have to go into a walk-in clinic or emergency room to get a new one. I strongly recommend that you do that as soon as possible.
Okay, I'm pretty tired. I was looking forward to getting home, but I'll see if I can get my son to take me. Thank you.
Thank you for waiting, Mr. Bush. As you know, I don't see your seizure medication on the discharge prescription, but the nurse did confirm that you were taking it in hospital, and we do know that your hospital stay was unrelated. You've been stable on this medication for a long time, and the consequences of stopping even for a brief period are very serious. Even if the hospital doctor did have a reason to stop it, continuing on the medication for an extra few days while I have a chance to confirm with your family doctor shouldn't harm you. Based on your previous history with our pharmacy, I should be able to renew it for you now so that you don't have to go without.
Thank you, thank you. I appreciate that very much.
You're very welcome. I'll follow up with your family doctor on Monday and let her know that I've renewed it for you. If there is a reason that they wanted to discontinue it, I'll let you know right away.
Thank you. Thank you.
Before commencing the values-based decision-making process, it would be helpful to describe what occurred prior to us joining the dramatization. The pharmacist has decided not only to fill the prescriptions that are written, but also to review previous therapy, as a component of a complete patient assessment. Proactively completing this assessment for a hospital discharge or when filling prescription renewals from any healthcare provider ensures medication-related issues are identified and addressed. This assessment should take place looking at the whole patient, not just new therapy. To simply check the written prescriptions would not, in fact, be in the patient's best interest. Foregoing a complete patient assessment is most likely the result of the pharmacist not considering the impact of the omission on patient care, rather than the omission being a conscious decision on the part of the pharmacist. Now, let's go through the process. First, establish the facts. Now for the next step. Ensure that everyone agrees on the facts. Next, we identify any competing or conflicting values or factors influencing the situation. The next step is prioritizing the core value of promoting and protecting the public interest. And finally, make a decision, and in doing so, consider correct action, correct manner, correct person, correct time. Provide a prescription for the patient. Contact the hospital or the family doctor on Monday to determine if there was a reason for the discontinuation. Follow up with the patient once clarified on Monday. Increase the wait times to account for the workload associated with prescribing, if required. The quantity provided could be a few days until clarification of the order could be made, or if the cost of the drug was reasonable, for a month's supply, so the patient would not pay extra dispensing fees. A 3-month supply would not be appropriate. Once the process is completed, it would be important to document the decision, patient response, and outcome. This case was based on a real coroner's report, where a patient died after sudden discontinuation of a seizure medication. Before we continue to Case 2, it's important to anticipate these types of problems and take steps to avoid the conflicts in the first place. For example, if the pharmacist is uncomfortable with the responsibility of prescribing, strengthening her knowledge base in therapeutics could be helpful. It would be important to address this as part of continuing professional development. Finally, a discrepancy, such as the example in this case, should be reported to a centralized system, such as ISMP, and to the hospital. Accreditation standards require medication reconciliation, and given the severity of the potential outcome, the situation could be investigated by the hospital to determine if changes should be made to their system. We will now consider another case scenario. In this scenario, Susan, a pharmacy technician working at a community pharmacy, faces an ethical dilemma involving a good friend and the friend's 14-year-old daughter, who are both patients at the pharmacy. Let's take a look.
Hi, Maria. How are you?
I'm doing okay, Susan. I'm here to refill my prescriptions.
No problem. We'll get that taken care of for you right away. By the way, we still on for the neighborhood barbecue this Saturday?
For sure. But I don't know if Ashley will come. Dave and I have been struggling with her.
Oh, I'm sorry to hear that. You mentioned she's been a bit distant lately. Have you had any luck talking to her?
It's been difficult since she started dating. I think the guy's name is Ryan. He's a few years older, and he's not a good influence on her. We just can't seem to get through to her.
I can imagine the stress you both must be feeling. If this were Rob and I'd be just as worried. Let me know if there's anything I can do to help.
Actually, you could do me a huge favor and check if she's filled any prescriptions. We're worried that this change in her behavior is partly because she's sexually active. I'm wondering if she's taking anything for birth control.
What do? I know Ashley filled a prescription last week. Doesn't Maria have the right to know? If it was me and it was my daughter, I'd want to know. What about Ashley's rights? Do I maintain her confidentiality? Maria really is a great friend. I'd hate to lose that.
Now let's take a look at a number of potential options on handling the situation.
Well, Maria, I can imagine how worried I'd be if this was happening with Robin. You know what? Because Ashley's still so young, and because she lives with you and is under your drug plan, I think it's best to tell you she did come by last week to pick up a prescription for birth control.
Thank you for telling me, Susan. I really appreciate it.
Well, Maria, I can imagine how worried I'd be if this was happening with Robin. Normally, I wouldn't give out this information, but because we're such good friends, and I hate seeing you this worried, I'll let you know she did come by last week to pick up a prescription for birth control.
Thank you so much for telling me, Susan. You're such a good friend. If the situation was reversed, I would have told you as well.
Well, Maria, I can imagine how worried I'd be if this was happening with Robin. Although Ashley's always been very mature, she still is quite young. I can't give you specific information about her prescriptions, but I will tell you that she does have prescriptions on file here, and she did pick something up last week. For any more details, though, you really will need to speak with Ashley yourself.
Thank you so much, Susan. I really appreciate it. I will speak with Ashley right away. They grow up so fast, don't they?
Well, Maria, I can imagine how worried I'd be if this was happening with Robin. I really wish I could be more help, but as I'm hoping you can appreciate, information about any patient is strictly confidential. You would need to speak with her about whether or not she is taking any prescription medications.
But Ashley is only a child, and as her mother, I have a right to know. I thought we were good friends. If the situation was reversed and I knew something about Robin, I would definitely tell you.
I'm sorry, Maria. I understand how you feel. But as I said before, information about any patient is strictly confidential. It would be like someone asking me about your medication. I encourage you to speak with your daughter. I really hope your discussion goes well.
I thought I could count on you.
Once again, let's consider the importance of recognizing that an ethical situation exists. If the mother had asked if her daughter was taking anything, and the technician stated, "Let me check." Upon seeing birth control on her file, she comes back and says, "I can't tell you if she has anything on file." It almost implies there was something that could not be disclosed. Alternatively, if the technician had looked up her file and saw something seemingly innocuous, and she told the mother so, it still creates a problem. In the future, can she continue to state, "I can't tell you if she has anything on file"? The importance of recognizing and anticipating situations in advance can result in appropriate actions aligned with core values. Now let's look at the scenario through the values-based decision-making process. First, establish the facts. Ensure that everyone agrees on the facts. Identify conflicting or competing values. Prioritize the core value of promoting or protecting the public interest. Make a decision. It may be helpful to document the action taken and to notify the other pharmacy team members of the mother's request in the event she approaches them. Let's consider this situation from a prevention perspective. The mother in this situation does not recognize her daughter's right as a mature minor, and unfortunately, this is not the situation where she would be most receptive to the idea. One strategy a pharmacist could implement is to consistently establish appropriate communication within a patient's circle of care. It proactively establishes whom the pharmacy is able to provide patient information to. This is important for everyone, but particularly so for more vulnerable patients, such as children or adolescents, and those with mental health concerns. It requires a discussion regarding the pros and cons with the patient and documenting the wishes within the patient file. Another challenge is the personal relationship of pharmacy teams and their patients. It is not uncommon for family and friends to support their pharmacist, pharmacy technician, or their respective pharmacy. The dual relationship, however, may restrict the normal flow of personal information between healthcare provider and patient. It may also create conflicts, such as the one in this case. This concludes the module for values-based decision-making. It is important that registrants recognize that this process will support them in making decisions that align actions and behaviors with the core values of the profession. It will take practice to become comfortable with this process, and it will be helpful to work through ethical cases with colleagues using values-based decision-making. If you have questions regarding the Code of Ethics or values-based decision-making, please contact the New Brunswick College of Pharmacists.